Hi, it's Dr. Sheila Dobee from Your Caring Dentist. I'm going to be introducing you to Dr. Valentine, who is one of our endodontists on our team. An endodontist is someone that does root canals, which I know a lot of people are scared about, but not when you see Dr. Valentine, because he's absolutely really great. He actually graduated the top 5% of his class. The other thing about Dr. Valentine is he was part of the US Navy, so he's super meticulous, which means that the quality of his work is absolutely amazing. Dr. Valentine is going to be answering a bunch of questions and answers that patients have about root canals. So here he is, Dr. Valentine. So Dr. Valentine, how are you doing today?
I'm doing great. Thank you very much. Thanks for having me.
Yeah, I'm so excited to actually get a chance to talk to you one-on-one, because most of the time you're covered in your scrubs and we don't really get a chance to see each other's faces.
I know it's a pretty incredible experience not having a mask on, talking face to face. So
Exactly. And it's good for our patients because they actually get a chance to see what you look like underneath all that PPE.
yes, absolutely. I'm glad. Sometimes wearing a mask, for a prolonged period of time, it's hard to communicate. So this is very nice.
Yeah, and that was the reason I wanted to have this kind of question and answer session, was because there's a lot of questions that patients have about root canal treatments. And if we can kind of answer these kind of questions here, then they won't have to be trying to ask you these questions when you're covered in PPE, and then sometimes they can't hear, or they come for an appointment and they might be a little bit stressed out. So a lot of patients want to know, why do they need a root canal?
A person may need a root canal because of several different reasons. The most common reason is the tissue that contains the nerve inside of that tooth is either unhealthy due to a prolonged or extensive cavity that the tooth experiences, or perhaps the nerve tissue has completely died off and is infected. Some other reasons are sometimes teeth can have a crack in it, which may cause a prolonged annoyance and discomfort, and may lead to one of those previously mentioned outcomes of an inflamed nerve, or a nerve that is completely dead and infected. And in those cases, a patient faces with several decisions about their treatment, and a root canal is an attempt to preserve those teeth and prolong their lifespan in a patient's mouth.
So what is the most common cause of a root canal that you see, Dr. Valentine?
I would say the most common cause is probably a cavity or a series of recurrent cavities that eventually led to some sort of inflammation in the tissue inside of that tooth, that the tooth was not able to heal itself, and either is in the process of dying, or the tissue inside of that tooth has completely died off and became infected.
One thing I'm noticing now is a lot of patients are clenching and grinding their teeth, and they're breaking their teeth, and then there's another cause of pain in that way. If a tooth is fractured, can it still be saved by root canal?
That's a really good question, and it's not a question that's easy to answer in sort of a generic form, because it's really case by case specific. It really depends on the extent of that fracture. Fractures in teeth sometimes could be clinically visualized and identified. Other times we have to rely on symptoms. They're rarely ever noticed on radiographs or three-dimensional radiographs, but we use clues on those radiographs to help us determine whether the tooth has a fracture or not. If the fracture is confined to the crown portion of that tooth, oftentimes we will recommend trying to save that tooth by doing root canal therapy, and then an appropriate restoration that most likely would include some sort of form of a crown to brace the residual tooth structure together to minimize the chances of that crack propagating further. The cracked teeth are teeth that oftentimes you always have to keep them on watch, and you always have to monitor, because we do know that cracks in general tend to propagate, but that doesn't mean that every cracked tooth needs to be lost or needs to be extracted. There are many cases that with early diagnosis, and if the crack is not extremely deep, the patient can still retain that tooth for many years.
That's why it's so important for patients, even if they feel anything, to come in as soon as possible to come and see us so that we can detect things early and treat them earlier. I know you and I have been doing a lot of really heroic dentistry where a lot of times a patient would have lost a tooth, and we've managed to actually been able to save these teeth, which is a great thing that we're able to do in our office.
Absolutely. I think it's very important. Early detection in any pathological condition leads to a better outcome long term, and especially in teeth that are cracked teeth. If we can catch that condition in an early phase where the crack is fairly shallow, and yet the patient has symptoms that lead us to a decision of doing a root canal therapy in the crown, those are the best outcomes in the long term.
Yeah, that's why in the office I invested a lot about early detection with our radiographs, our transillumination technology, the microscope that you use. It just allows you to actually see down those canals and see things that most people can't see because we've got the technology in the office.
Absolutely, that definitely helps. I think as a profession of endodontics, in my field, we are moving, definitely have been for a while, using microscope to help us detect, especially during the procedure, the extent of those cracks, and help us detect different features within inside of the tooth to assist getting the best outcome that we feasibly can get during treatment.
Thank you. Let's talk about symptoms. How does the patient know that they have, people know they have a toothache and then they worry, they're like, oh my gosh, is this going to be a root canal? Is there advice that you can give our patients to kind of let them know what's an indication that they may need a root canal?
That's a great question. This question probably has many different answers because the presentation can vary between between different patients. And sometimes that could be very confusing because we associate pain with a problem, and we associate lack of pain with no problem. Unfortunately, the way that we have been, we've evolved as a human species, kind of granted our mouth a very tolerant environment. And many times we have issues that are pathology, however, they don't present themselves in a painful manner. So to answer your questions, in sort of a more systematic way, that can range from a presentation of a tooth that requires root canal therapy or potentially requires root canal therapy, can range from somebody who has no symptoms at all, and perhaps that was, we have noticed some sort of evidence of an infection on a periodic routine x-ray that we have taken, and did further investigation to determine that that tooth is not healthy. That would be one sort of extreme. And on the other extreme of the presentation, you can have somebody who has, severe spontaneous pain, perhaps in certain cases a swelling, and they haven't slept in a couple of nights because it's been so painful to chew, to bite. Oftentimes it's very confusing where the pain is coming from. The patient cannot really point at a specific tooth in early stages of that problem, but they have a severe pain that goes to different parts of their face in many instances. So that would be the other extreme of that presentation. And then there is many presentations in the middle. Right? There are cases where a patient can experience heightened sensitivity to cold that kind of tends to linger even though you've removed that cold stimulus from the mouth. Occasionally, you can have a vague or a more specific sensitivity to biting on a specific area of your mouth that maybe is getting progressively worse. Occasionally the patient will present and will tell their general dentist that, I don't really feel any pain, but there is this weird pimple on my gum tissue. And periodically it'll swell up and pop, and periodically pus will come out, but it doesn't really bother me. Is there any issue? and we'll, of course, investigate further and determine whether that's the source of that pimple is a root canal associated infection. So there are many different ways that the patient can present. There is no one clear-cut scenario or kind of like a pattern scenario that we can say that all patients fall into that.
Well, thank you, because as a dentist, I see so many symptoms where you're right. The patient they don't feel anything, and they're like, well, how come I need a root canal in the tooth? And we take it as a special kind of X-ray, and we see that there's an infection, and then they're lucky enough that we can treat it early before it becomes a problem. What are the dangers of letting a tooth that needs a root canal go undetected?
That's a very important question. Oftentimes, the problem associated with the root canal, and kind of like I mentioned in the previous answer, can be silent or near silent without any severe symptoms in the long term. However, depending on where that tooth is located and depending on what kind of an infection is in the tooth, if it is indeed an infection, there's always a risk of developing pain that can range from mild, moderate, or in some instances extremely severe. And the outcome that is more worrisome for us is an outcome of a swelling. So in cases where those teeth are indeed infected, depending where those teeth are located, in some patients, those patients can develop a swelling from a tooth that hasn't been treated in a timely manner. And in extreme cases, those swellings can go into very dangerous areas of our face and our neck. And that could be in very rare cases, however, but nonetheless, that could be life-threatening as well. Say, there are presentations where patients will come in and we will do an assessment and we'll find the tooth requires treatment, and their question, I would like to know when they should treat. And our answer is, from a clinical standpoint, if the tooth requires treatment, it probably should be treated as soon as possible. And the reason being is that although the frequency of these very, very severe morbid kind of presentations are not extremely high, we don't have a way to predict which patients will progress into which outcome. Whether this particular patient in front of me will be pain-free for a very long period of time, right? Or the patient next to them is more at risk of developing a life-threatening, potentially life-threatening infection. So from a clinical standpoint, if there is an issue, there is a need for treatment, regardless of pain or presence or no pain presence. Now, there are some presentations where we can, with reasonable assumption, tell the patient that this is not very likely in the short term to progress to a very severe problem. So the patient can have perhaps a short period of time to plan towards that treatment. But I would say that is not the majority of the cases. Most of the time when the patient presents, we either see a need for treatment due to symptoms that are there, or due to a potentially worse outcome. So to make this answer shorter, from a clinical standpoint, if a problem has been identified, it is always better to do treatment earlier to eliminate a risk of increased morbidity associated with that infection or inflammatory issue.
Yeah, thank you. And that just reminds me to emphasize how important it is for our patients to come in every 6 months for their routine examinations, because that's how we detect early lesions before they become problems such as root canals. We have a lot of new patients that come in because we see same-day emergencies that their dentist is closed and they come in, they've got a big swelling, and it's very difficult us to kind of get it under control because they've waited so long, but we always manage to take great care of them. But they've waited so long that it's much more complex to treat it at that level than it is when we get it at the early stages. So
Absolutely.
yeah. So Dr. Valentine, so there's sometimes it's like we're open 6 days a week. One day we're closed on Sundays. We do see same day emergency patients. But sometimes it's like, midnight on a Saturday night, you can't get hold of a dentist and you've got this crazy toothache. What's the best medication to take before they can actually get to come in?
That's a very great question. And the best medicine is prevention. Obviously, cases of midnight pain on a Saturday night, I can't recommend a specific medication because that would really depend on the patient's medical history and what allergies are and some other conditions that, perhaps preclude one specific patient from taking that medication. However, that being said, majority of the pain associated with root canal issues comes from an inflammatory source, meaning that if you can reduce the inflammation around the area of that affected tooth, the pain usually either subsides or is significantly reduced. And if a patient is able to take for their on their daily basis some sort of an anti-inflammatory medication, it tends to work the best way. Now, there are some patients that don't fall into that category. For example, patients with some heart conditions or patients that have specific allergies to certain types of medications, or perhaps patients that have digestive issues that cannot tolerate anti-inflammatory medicine. But for the bulk of patients that are able to take anti-inflammatory medications, the best medicine is an anti-inflammatory medication such as ibuprofen or Advil, in some cases naproxen, which is a longer release type of medication. And those tend to work very well. However, again, this is not a specific medical advice for anybody who's listening, but generically, if you go and buy an over-the-counter medicine and you take one tablet for a headache, that is a specific dose for that particular condition. Usually the type of pain that one associates with the root canal therapy could be oftentimes described worse than child labor. And in those cases, you have to take a higher amount of that medication. And generally, just as a specific example, again, not for any one specific patient, but an ibuprofen, for example, you would take something along the dosages of 600 milligrams every 6 hours, or up to not to exceed 800 milligrams every 6 hours. Now, again, one has to keep in mind that there are a subset of patients that may not be a good candidate to take high doses like that. So it really is something that you need to get on the phone with someone, or you can rely on maybe perhaps your previous experience. If you were able to take those doses previously and you don't have any substantial medical changes, then you can take that medication. But yes, anti-inflammatory medicine is probably the best type of medication. Now, a different type of medicine for those who cannot take an anti-inflammatory would be something like acetaminophen, or widely known as Tylenol. Again, you have to be more aware of your medical conditions and perhaps discuss what dosages would be appropriate for you. But that medication would be an alternative as an over-the-counter remedy. Going one step further, if one is able to get a prescription for a strong pain medicine, some form of a narcotic medication is an option. Now, that being said, we're currently in a state of sort of medical awareness of issues that are associated with narcotic medications. And we also know that research shows that narcotic medication doesn't always work better than traditional anti-inflammatory medications for the type of pain that the root canal issue can cause. And at the same time, narcotic medication brings a whole set of other associated side effects potentially. So although it is an option for more severe extreme cases to take a narcotic medicine that was prescribed by your dentist or your physician, that wouldn't be my first go-to choice as a prescribing doctor.
Thank you for that advice. That's really useful, because there's a lot of patients that aren't patients of ours that might be watching, and they don't have the resources to get to a dentist immediately. That can kind of just tie them down before they get an appointment. A good root canal requires a few things. It requires a good diagnosis, it requires an amazing endodontist such as you, and it requires good technique and cleaning out the canals like fully. One of the things I've noticed over the 20 years is just the difference I've seen in the root canals. And one of the reasons I love working with you, Dr. Valentine, is you're very meticulous. I see that, everything's very organized. You take a good amount of time to completely clean out the canals, and then you fill the canals completely to where they need to be done, and they're just beautiful. And I've noticed that the patients really just don't have many issues afterwards. So it's really important to have this kind of work done with an endodontist that's very passionate about what they do. Can you tell me a little bit about why you decided to be an endodontist?
Well, it happened for me that I enjoyed the fact that doing root canal therapy had a pretty profound impact on quality of life. And it was a very instant thing that we see, right? Within a few days, you can see an improvement in somebody's condition after root canal therapy that was successfully performed. Versus perhaps in other modes of treatment, it is a ongoing relationship with the patient and the dentition, and trying to kind of hone and master a field that requires many different visits. For me, in my case, I felt that I'm a little bit more nitpicky. Would that be?
That's great. I think it's a great thing for the nitpicky, because I've seen you kind of go in there and just get that last bit of infection out, and you'll do whatever it takes. And that's one of the reasons we love having you on our team, because we know that you do such great work.
And it allows me to, every field of dentistry requires different skill set, and every practitioner has certain strength in different areas. And for me, I found that my particular skill set was in sort of peeling the layers of the onion of trying to figure out where the problem is coming from, and at the same time having the patients to sit down and look in a small, tiny little space for prolonged period of time to try and figure out how do we get all that problem from inside of that tooth, and getting a patient back to a healthy, hopefully pain-free and infection-free state. So, it's probably would be a different answer for anybody, for another endodontist, because we all get to a specific point via different roads. But that was my story. It was a lot of soul searching and trial and error and figuring out what works for my particular character.
Now I can relate. I've wanted to be a dentist since I was 13. So I think we're very fortunate that we're in a profession that's so great. And thank you so much for taking such great care of our patients. I see them, but so many of them are so worried and nervous about coming in to get a root canal, because they hear from their friends that have had root canals, and then pretty much every single patient comes out and this is like, oh, that was so much easier than I thought it was going to be, and it's so comfortable. And we follow up the next day and make sure our patients are, we check in on them, and they're always just like, that was easy, it was comfortable. And the thing I like also about you is the fact that you're very accessible. If a patient has a question, they can call you, and you always respond really fast, and you take such great care of them.
Well, thank you. I appreciate the kind words. It's important to know, for me personally, that patients that we've treated have access to some sort of a follow-up care. And yes, oftentimes if there are specific issues, then they can definitely get a hold of me, and hopefully we can resolve or address those problems. I feel that our field of dentistry in general, and more specific root canal therapy, has evolved, and our techniques can kind of honed in to allow for speedier procedures that are a little bit more precise, a little bit more tolerable, and definitely yield a more positive result. And all that in combination makes a patient experience much better. So.
Yeah, I've seen that over the years, just the technology. I mean, even the instruments, I see that you're always kind of looking at the up-to-date materials that are out there, and we're getting constantly changing things to make sure things are more comfortable, better outcomes. So that's another great part of our profession, is we actually evolve so fast that things get so much better and so much easier and quicker for us.
Absolutely, absolutely.
So is there any lasting things that you'd like to say to our patients about root canals?
Well, first, I'd probably say thank you for, giving us your trust and your time, and allowing us to, extend our treatment to make sure that you're feeling better and doing better, and you have a beautiful and healthy mouth. I urge you to ask questions. I think that's very important. Obviously, a lot of our patients are very savvy, and they do a lot of research before they come in, and they ask wonderful questions. And at the same time, I urge you to keep that information as a handy tool to ask those questions. But we hope as clinicians that you will extend us the trust of the knowledge that we've worked very hard to acquire so we can serve you properly. Meaning that there is a lot of information out there, and not all of that information is necessarily valid, current, or accurate. We welcome you to ask questions about all of it, but we encourage and hope that you would give us that trust to allow us to perform the best treatment for you with our recommendation. And obviously, in every treatment that we do, whether it's root canals or crowns or extractions or implants or dentures, it's a communication and dialogue that we're having with our patients. And our goal is to give you options, and your goal is to choose the options that are the best suited for you, hopefully relying on our expertise to recommend the best options for you. So again, thank you very much for giving us an opportunity to treat you well, and hopefully we will continue to do so.
Thank you so much for your time, Dr. Valentine, and look forward to seeing you soon in the office.
Absolutely. Thank you very much for having me over.
Thank you.